Hello and welcome to COVID-19 Right Now from the Yale School of Public Health. I'm James Hamblin. I am a lecturer at the school, and I am joined today by Chen. He's an assistant professor of epidemiology. His focus is on climate change and air pollution. And since we are talking always about COVID-19 on here, we're going to be discussing today the impact of climate on the virus and impact of virus pandemic on the climate. Thank you so much for joining, Dr. Chen.
Thanks, Jim. Glad to be with you.
Since this is a live show, if people have questions, please drop them in the comments and we will do our best to answer them. And like always, I like to start with just asking what is at the top of your mind right now. There are so many aspects of this pandemic to worry about. What's keeping you up at night?
Yeah, for me, because this pandemic involves in first outbreak from China, so that's naturally making me looking at all the news in China, what's happening there, worry about that, my family there, and eventually doing some research about that. So that's, I think at the first beginning, it's the numbers that make me alert every day that there are new cases there. But then later, I feel like watching this pandemic is like you are watching a fast forward climate change crisis, there are so many similarities, but they all start with denial and not enough transparency, not enough action. Then later it's a little bit late. So there's some thinkings on the similarities, but also differences among them.
Yeah.
To discuss.
Yeah. Okay. So there's a lot to break down here. We'll get into this. Again, if people have questions, please drop them in the comments. So one thing that I have heard a lot of people noticing is that air pollution levels are particularly good right now. People aren't traveling, things are shut down. And there's a narrative that is at least temporarily a positive impact on the climate. Is that something that will be meaningful in the long term, or what are we learning from these short-term observations?
Yes, that's a very good question. Yeah, so we definitely see a massive but temporary reduction in air pollution. So we just did a study to looking at the air quality levels in China. So across China, we see roughly 30 to 40% reduction in the air pollution during the quarantine versus before the quarantine period. But since the lift of the lockdown across China, we saw many places the air pollution levels has rise up again. So as you mentioned, this kind of cleaner air we see is likely to only last 1 or 2 months. So in terms of the long-term impact, it doesn't actually improve our long-term air quality goal that much. And another thing we noticed that, so behind the air quality improvement is because we drive less, right? We have very less energy use and then leads to less emission. So one thing interesting for the air pollution emission is a lot of these emissions, they're not just emitting air pollutants, they're also emitting a lot of we call greenhouse gases. So there are studies actually this week just published in Nature Climate Change saying that by the early of April, the global carbon emission compared to last year has dropped by around 17%. Wow. And we saw more than half a drop in the transportation sector. And also, as you can see from the news media, that the aviation sector has been a big hit during this economic crisis and also pandemic. So they also have attributed less carbon emission. Mm-hmm. But likewise, like the air pollution, this carbon emission is going to be temporary, and it doesn't have that as much benefit as you thought to the climate. Because when we talk about the carbon emission, it's actually the cumulative emission matters. It's not just the short-term 1 month reduction. That's not gonna make a big benefit for us.
Right. Are we learning anything though about, this is sort of an unprecedented experiment where we can see people have been advocating for aggressive changes to transportation to limit greenhouse gases, to limit air pollution. And suddenly we're living out this sort of experiment where people are traveling less. Is it informing anything, saying like, what could be possible if we were to make longer term changes, about the potential to mitigate climate change?
Yes, so definitely. I think what surprises us is usually if you want to really achieve this 30 to 40% reduction in air pollution, it takes years of efforts and it's not something that happened in weeks. However, in fighting this pandemic, we see that after the lockdown of Wuhan, the massive quarantine measures taken in China and also now taking the stay-at-home orders throughout the US has also reduced the emission in weeks. So this is surprising and also tells us if we can do something aggressively and decisively as we are fighting the pandemic to reduce the air pollution emission, but not in current way, but in a more sustainable and healthy way, we can still achieve the cleaner air, avoid the enormous health burden of air pollution and climate change without having this devastating death toll of coronavirus.
Right. Can you say a little bit more about the health toll of air pollution? Because I think this is something that so many people have just we take for granted as something that is built into, there's a lot of death and chronic illness that's caused by air pollution, as if this is just given, there's nothing we can do about it. But the numbers are extremely high. Do you, offhand, what are the best examples of the impacts of air pollution on human health?
Yeah, so this, I think it's particularly because we are in the US, so people will say, oh, we already have a clean air, but let's not take that for granted, because US has also taken decades to achieve this. From the 1950s, when we all, in the US and in many Western countries, having this severe air pollution. And it takes decades to phase out all the fossil fuel and all the old technology that leads to this air pollution. That we take decades away to achieve this. However, I want to point out that even currently, the air in the US is not that safe enough. So there are roughly ten thousands of premature deaths in US each year can be attributed to the PM2.5. So that's still an enormous number. Right. So that's the case in the US. So, but if we go to look at developing countries like India and also countries like China, there you have more than 1 million premature deaths each year due to the severe air pollution. So the death toll is definitely, the outdoor air pollution is now globally the 5th risk factor for the premature death.
Wow.
So that's how enormous the health burden of air pollution is.
Is there any relationship between that burden of air pollution and the outcomes you're seeing from COVID-19? As in, are we seeing places that have a higher burden of respiratory disease from air pollution? Are people less resilient when they develop the viral disease?
Yes, that's a good point. So there's some preprint studies which haven't been peer-reviewed yet, showing the evidence that, okay, there's likely people living in areas with long-term air pollution, they will likely have damaged lung function to cope with the COVID-19. So which means that if people living in the heavily polluted areas for long-term, then they will likely have higher mortality rate of case fatality rate during the pandemic. So there has been some evidence but I would say we should take that cautiously.
Sure.
So scientists are still taking more research to find out what's the real relationship between severe air pollution and the COVID-19 severity.
Right. I imagine these things will take time to play out, but it's an interesting hypothesis. And again, to note, if people are watching, if you have questions, please just put them in the comments, and we'll do our best with them. I had initially, so I've heard a fair amount about these short-term improvements in air pollution that we're seeing. There's another side of this too, which you had mentioned, which is not just that the shutdowns and the pandemic are influencing the climate, but that the climate influences pandemics, infectious diseases of all sorts. Specifically with this coronavirus, what can we say about the impact of the climate on the virus?
Yeah, so as you mentioned, I want to emphasize that so far there's no evidence saying that climate change caused this pandemic. But we do know, as you mentioned, climate change makes the infectious disease more, there are more vector-borne diseases and waterborne diseases. These infectious diseases are likely to be spread more with the warmer climate. So that's one thing for sure. And the other thing I want to emphasize is this year, actually, the climate scientists are projecting that this coming year is likely to be the hottest year on record. As a matter of fact, the last April, we just went through, is also the joint warmest April on the human record, on the record that we have measurements. So with the warming and very hot summer coming, if you imagine some elderly population without air conditioning under the stay-at-home order, that will be a very challenging and difficult time for them to cope with the heat wave, to cope with the climate risks, but also to protect themselves with the COVID-19 pandemic.
Right. So some people are going to be in extremely hot places and being asked to stay at home, and they can't. They're going to choose between two risky things, which is to go out to find some place to cool down and to incur risk of the virus. That is a bleak scenario. So that could potentially lead to more, transmission that we are not predicting in some models already of the outbreak. Is that right?
Yes, exactly. If you think about if we don't have this pandemic, so during the heat waves, so what do people do? If you don't have air conditioning, you go to places we call cooling centers. For example, you go to the library or the swimming pool, right? However, during this pandemic, a lot of these public these cooling facilities are either not open, or the people may fear they go there and they may get infected from other people, so they don't go there. So these are the risks that these extreme weather events could make people more vulnerable to the pandemic. But I want to point out, it's not just the extreme heat summer. It's also a lot of other extreme weather events. This week, actually, the news reports that there's a major cyclone made the landfall in the eastern India and Bangladesh. So a lot of people, they have to just go to the emergency shelter, right? So in the shelter, it's hard to keep the social distancing, and a lot of people don't wear masks. So it could increase the potential to getting infected. So that's the thing, that these extreme weather events are coming, no matter we are facing or not facing the pandemic. They are coming. So they will damage our capacity to deal with these extreme weather events, and also make us much more vulnerable.
This is a bleak picture, I'm wondering what can be done. It seems like you highlighting that there are similar factors going into this. You said that this pandemic is sort of like a warp speed version of a lot of the forces that we're seeing in climate change, at least in how it's playing out and what factors make it worse, and what could be done. What could be done right now to help eliminate sort of, or fight against both of these problems? What is most needed from the public health community?
I think I think first thing we landed from this pandemic is early action matters, right? If we could be able to issue the stay-at-home order 1 month earlier, we won't see these millions of cases in the US. So likewise, if we do these protective measures early enough, we can prevent these damages. So that's why we're talking about the incoming summer heat. If people that who are vulnerable to the pandemic, but also vulnerable to the extreme heat events, like the elderly people with low income, and people with color, if they can have the awareness that how to cope with extreme heat during the summer, and how to better protect themselves, either doing work or at home, they will be better prepared for these two things. And also, I think that it's not just that our public health community should raise our voice about these damages. It's also, we need the government leadership and also support. For example, there's recently New York City issued a COVID-19 heat action plan. They will deploy, I think, more than 70,000 air conditioning units to the low-income families, and they will issue some subsidies for utility use for families who can't afford running this air conditioning. So I think there's a lot of actions that that local governments can take action to help people better cope with the coming heat summer.
Can I ask you about something that's sort of an interest of mine? The parks, the public spaces. When you talk about people needing to get cool, sometimes maybe either don't have air conditioning, can't afford to run it all the time. People go to pools and libraries. Indoor spaces are going to be bad. Pools are going to get too crowded for everyone to be at. But we have big parks, and different places around the world have taken different approaches to those. Some have closed them altogether or really limited the number of people who can go in, and other places have opened up streets and tried to create more public spaces for people to go to. What's the right approach, especially during the heat of summer?
Well, I'm not an expert on the infectious disease control, but as I think many experts has been talking about, we should also keep the physical activity, but we need to take the right measure to wear masks and keep the social distancing, even if you go out for go to the parks. I still feel like in many places we do have I think the advantage here that we don't have that higher population density like many developing countries. If you think about India, a lot of people there, they don't have the advantage to go into big parks and while keeping the social distance. So I think in many places there will be different measures, but in places that we can go to large parks, enjoy the nature while to have the green shelled forest. I think as long as you take the right precaution and protective measures, I think definitely it's worth it.
Yeah. A lot to think about here. There is a lot to be concerned about, but it also seemed like some hope that we're proving that many businesses are being extremely hurt. There's much economic devastation right now because of the shutdown. At the same time, there's some some businesses and some ways of life that are proving that they can work really well without traveling. And I'm thinking specifically of telemedicine. Meetings are being done online. People are going to rethink commuting. People are going to rethink travel to things like weddings. If maybe half the group could join by Zoom and only the close friends need to travel, these things will at least be on the table going forward in a way that they were just culturally anathema before. Do you think in the long term, because of that willingness for people to do more, or just we're getting used to doing things remotely, that could have a longer term impact on the climate?
Yes, definitely. I think to move forward, in addition to what we need the government to do decisively to reduce the emission from industry, from fossil fuel industry, but we can do a lot of things like we have been doing amid this pandemic. One of the things you talk about is maybe in the future we don't need that much in-person meeting, so this video conference will likely be enough, and also a lot of webinars can be taken in rather than in-person lectures. Especially when we're talking about, if you are inviting professor from overseas, then the aviation carbon emission for the travel will be very large. So I think while we can definitely keep that this habit and this tradition, so to help us reduce the emission from both air pollution and carbon emission, I think this is definitely a good sign. But also, I think to move forward, generally, I think we should move to build a more sustainable and a healthier community. So, including doing these video conferences, Zoom meetings, but we also need to reduce the use of fossil fuel. And also, one thing I think at Yale and also the Yale School of Public Health has been very wonderful is to move towards a sustainable community. I know Yale School of Public Health has been trying to phase out these single-use plastics. All these things, I think, can help our society to become more sustainable, which on the long run will help us fight the climate change crisis.
Right. I think a lot of people are feeling disempowered now, and there is a lot to be concerned about, a lot of uncertainty. But it's also a reminder that every single trip we don't take, every single piece of plastic we don't use, every single way that we're learning to adjust now is a beneficial thing that you're doing, and people should feel good about that, even though it's sometimes very difficult. And going forward, these things we can be more conscious about these things. I should wrap up, unless, is there anything you wanted to come back to or that I didn't get to ask about that you want?
I think there's one thing I want to mention of that is I want to quote a phrase from an ancient philosopher in China called his quote is that if we do not change our direction, we will end up where we're heading, right? So has been long-term warning from health scientists about the pandemic. However, we are not prepared. The preparedness in our society is woefully inadequate. Likewise, our scientists have been alarming the climate change crisis for decades, right? So if we can really change our current pathway to curb the carbon emission curve, to become carbon neutral, to reduce, to become a sustainable and healthier society, we can prevent this enormous health burden.
Yeah. Thank you so much for your time. It's terrifying and also inspiring. All right.
Thanks again.
Best of luck and continued work. And thank you everyone for watching. We will see you next week.